Chairman Barrett, Ranking Member Budzinski, and members of the subcommittee, thank you for inviting us to testify today on the use of artificial intelligence at VA. Develops in generative AI, which is a subset of AI, which can create text, images, video, and other content when prompted by a user, have revolutionized how the technology can be used in many industries, including healthcare, and at VA and other federal agencies. AI holds substantial promise for improving the operations of government agencies. However, it can increase risk for agencies and poses unique oversight challenges because the source of information used by AI is not always clear or accurate. Given the fast pace at which AI is evolving, the government must be proactive in understanding its complexities, risks, and societal consequences. It should also be noted that VA has experienced long-standing challenges in managing its IT projects and programs, raising questions about the efficiency and effectiveness of its operations and its ability to deliver intended capabilities. As requested, I'll briefly summarize our prior work on the department's AI use and challenges, as well as principles and key practices for federal agencies, including VA, that are considering and implementing AI systems. In July 2025, we reported that VA's AI use cases increased from 40 in 2023 to 229 in 2024. For example, VA is developing a generative AI use to automate various medical imaging processes. This use may enhance VA's ability to analyze medical images, integrate existing and new data workflows, and create summary diagnostic reports. In the health and medical sector, agencies have adopted generative AI to advance medical research and improve public health outcomes, including at VA. It's also worth noting that of the 229 use cases, 64% were considered to be high-impact AI, meaning that their capabilities impact the rights and/or safety of individuals or entities. And looking at just VHA, that percentage increases to 72%. The department also reported to us a number of challenges they face in using and managing generative AI. The full list is noted in my written statement, so I'll only highlight a few here. Challenge 1, complying with existing federal policies and guidance. VA officials shared that the existing federal AI policy could present obstacles to the adoption of generative AI, including in the areas of cybersecurity, data privacy, and IT acquisitions. Challenge number 2, having sufficient technical resources and budget. Gen AI can require infrastructure with significant computational and technical resources, and VA noted challenges in obtaining or accessing the needed technical resources and also in having the funding necessary to establish those resources and support desired AI initiatives. And the last challenge, hiring and developing an AI workforce. Among other things, VA reported difficulties in establishing and providing ongoing education and technical skills development for their current workforce. VA officials told us they are working towards implementing the new AI requirements in OMB's April 2025 memorandum, and doing so will provide opportunities to develop and publicly release AI strategies for identifying and removing barriers and addressing the challenges I noted. Additionally, GAO has identified a framework of key practices to help ensure accountability and responsible AI use in the design, development, deployment, and continuous monitoring of AI systems. Our framework is organized around 4 complementary principles that address governance, data, performance, and monitoring. Consideration of the key practices in this framework can help VA as it considers, selects, and implements AI systems. Lastly, I'll mention that we have 26 open recommendations to VA concerning the management of its IT resources. If the department implements these recommendations effectively, it will be better positioned to overcome its long-standing challenges in managing its IT resources and will improve its ability to address the rapidly changing AI landscape. That concludes my statement, and I look forward to addressing your questions.